Hi, my name is Paul Haan, and I am the lead program specialist here at the City of Grand Rapids. Prior to coming to the City of Grand Rapids, I was the founding executive director of the Healthy Homes Coalition of West Michigan for more than 14 years. It has been my privilege and good fortune to get to know the fine folks at the National Center for Healthy Housing. We've worked together for nearly 20 years, and I've learned that they are an aggressive voice for healthier housing for children, not only here in my community in Grand Rapids, but also in your community and communities across the nation. I can't think about the National Center for Healthy Housing without thinking about what it means to be an advocate. They advocate for more protective health policy when it comes to housing. They advocate for needed funding and resources. They advocate in partnership with organizations big and small from across the nation. But most importantly, they advocate for children. You see, in our local communities, too many children are still hurting. Children are hurting because they have unsafe places to live. Children are hurting because too many folks are still unaware or unequipped to know about hazards in the home like lead, like asthma triggers, like carbon monoxide. Children are hurting because there are not enough dollars at the end of the week, at the end of the paycheck, for hardworking parents to afford repairs to the home. They need our help. Unfortunately, children are hurting because there are still some people in this world who feel it is just fine to trade children's health for deferred maintenance so that profits from rental housing can be maximized. Those children need a voice. The children need you. They need the National Center for Healthy Housing. Because no one should be able to trade children's futures for profit, we all share the responsibility of making sure that children have safe places to live. As I mentioned earlier, I met the folks at the National Center more than 20 years ago. That seems a lifetime away. There was no gray hair in the beard then. I think I was still sporting a ponytail, and at times this beard was a lot longer and a lot more goofy. While we have all changed a lot, the National Center has been a constant. From day one, the National Center helped me learn how to advocate effectively. The National Center quickly connected me with awesome, passionate advocates from across the nation who helped forge my resolve to speak up and demand commitments for change. Advocates from such far-flung places as Providence, Rhode Island, Los Angeles, Baltimore, Kansas City, Omaha, Detroit, Greensboro, Minneapolis, Chicago, and New York, even tiny Rochester, New York. You all know who you are. When I was the director of a small upstart nonprofit working on the cutting edge of this field of healthy housing, and now as a public employee of the City of Grand Rapids that has healthy housing in its strategic plan, the National Center has and continues to be about how we advocate. Together we advocate smart, thanks to the expert research and knowledge of the center staff. Together we advocate aggressively, thanks to an organization that knows what it is like to be bold, to push the envelope, and to not take no for an answer. Together we advocate consistently and with integrity. The National Center has been in the center of the fight year after year, pursuing healthier housing for the American people. Their facts are straight up honest and evidence-based, and their knowledge is deep and their expertise second to none. And together we advocate, well, together. Coming from a small Midwestern city, the National Center didn't treat my concerns, my community's concerns, as second rate or less because we happen to be located in a small town somewhere in the Midwest, somewhere in the Great Flyover. Instead, they connected Grand Rapids with advocates from other small communities and large communities to do great things. My deepest affection for the National Center has always been that they do this work together. They do it together as parents of lead-poisoned children from Grand Rapids share their stories, and they join national advocates, experts from inside the D.C. Beltway, to meet with congressional leaders to tell their stories and to advocate for a more just society. Together, as the National Center connected our small organization to others doing similar work, so we can innovate and share learnings. I'm thinking especially of you, Omaha, and Kansas City. We have always done this work together as the National Center connected our community to the needed resources to do the work of building a parent coalition, of innovating on asthma programming. Together, to simply share stories, expertise, or even get around a table where we could break bread and know that we are not in this work alone. To the staff at the National Center for Healthy Housing, past and present, thank you for including us, for advocating with us, and for teaching us. I'm sure I will forget some, but from the bottom of my heart, thank you, Rebecca Morley, and thank you, Don Ryan. Thank you, Susan Assetti, Jonathan Wilson, Joe Miller, Amy Murphy. We get to include Amy Murphy in this, don't we? Sure we do. Thank you, Sarah Goodwin. Thank you, Dave Jacobs. Thank you, Christopher Bloom, Amanda Reddy, and certainly thank you for keeping it all glued together, Laura Fadula. I look forward to working together with the National Center in the future and to the successes that they will help bring to both Grand Rapids, in your community, and the nation, and most importantly, the success they will bring for our children. Happy 30th anniversary, National Center for Healthy Housing.